So we finished upper extremity. We're going to start working on the lower extremity. So your next proficiency is for toes, feet, and the calcaneus. So we are going to start with doing an axial toe projection. So I'm going to have my patient place her foot just right on top of this cassette. One thing that students struggle with is your CR angle for the toes and the foot. Your foot has a 10-degree angle and your toes has a 15-degree angle. Because they're so close to one another, students tend to forget which one is which. I always tell students you have more toes than feet, so you have this higher or the larger CR angle for the toes than you do the foot. And sometimes that helps. Okay? So I'm going to put an angle on my tube. It's 15 degrees, like I said. And that CR angle is headed towards the heel of the foot. And then your CR is directed to the third MTP if you're doing the full set of toes, or whatever MTP joint you're working with for whichever toe is of interest. So I'm going to shift her just a little bit here. And then make sure that you collimate down just to that toe area, because we don't need anything more than the digits. And then put your marker within that light field. That's my right marker. If I was doing just one specific toe, but the doctor wanted to see all the toes like in this image, you can take something that you have. I don't have a lot with me right now, but if I had a pen or a pencil, I'm just going to use this little tweezer set for the moment. I can take something that's radio opaque and just direct it towards the toe of interest. This right now is directing right at that fourth digit, so if it was a fourth digit that was injured, I could work there, or move it to whatever specific toe was injured. A pen works really well. Next one we're going to do is for your AP oblique toes. Make sure you take your angle off your CR for your oblique toes, since you no longer need that. The only axial projection for the toes is for your AP axial. Rotate that foot in, so again it's at a 30 to 45 degree angle, medial rotation, not lateral, medial rotation. Get your marker on there, and again you could center to your MTP joint, and you could use a pen or something radio opaque to point out directly which digit you are working with. So for the lateral toe projection, you need some tape. You want to have it folded in half so the adhesive isn't touching the patient. The lateral foot can be a little difficult because of the fact that it's like the hand. If your first or second toe was the one of interest, you'd have to have the medial side of the foot against the IR, just like that. And if it's the fifth, fourth, or third digit, you would need it to be medial or laterally against the IR. Okay, so I'm going to do the fourth digit, or attempt to do the fourth digit with what I have here. I'm going to just scoot this a little bit, and what we're trying to do is pull the other unaffected digits out of our light field. So we'll have better tape in lab, but you're just going to loop this tape distally, and I'll maybe do that last. I'm going to start by pulling the fourth out. So I'm going to loop the fourth little toe away from the pinky toe and the other digits. I'm just pulling this toe forward and getting as much separation as I can. third and fourth toe. Again, the distal portion. And pull that back away from that fourth digit. That's fine, I'll just tape this other half of this tape separately if I need to. This tape, again, this is not nearly as hard if we have the marker tape, so don't watch this in a state of panic. I'm not going to pretend like it's fun or super easy, but it's definitely not as challenging when you have the right tape. So now if you look from above, which I'm going to see if this picture shows this well. Now if you look directly from above, and I'll end up moving this, but I'm going to get it just towards the foot, you can see that that digit is separated from the rest of the toes. Okay? So I'm still trying to get this on the MTP when we're all said and done here. So I'll rotate that. And we are just going to move her towards the center of the tube since this room doesn't move. Okay? So again, just centering that approximately to that MTP and getting the affected digit as close to the IR as you can. Okay?